Hello, everyone.
Hello, Jennifer.
I don't know what's wrong with my video. It doesn't let me turn it on. It's strange. Sorry about that. I'm trying to turn on my video and Zoom seems to be against me today. I don't know what that means. So I think we're still waiting just another minute or two. We have 35 on, but just to say, the agenda today, in case you didn't have a chance to look at it. We have Kate Rougvie going first, and she's going to talk about just giving us an update on the GBV IMS global work. There's a number of our core members who are also quite active with the GBV IMS, so it's good to get that update. For those of you who are less familiar with the GBV IMS or hear it named a lot but aren't so sure really what's happening. And then we're going to have the coordinator present on Afghanistan. They have some serious funding issues, so it's good to let people know what the situation is there. And then finally, we're going to have an update on Mozambique, which has been another country where it's been a pretty significant country recently getting attention based on the needs. We have a less packed agenda today, which means we will have more time for questions and answers. So definitely feel free to ask questions. You can also write them in the chat. And if you have something you'd like to say at the end, if you have an AOB, then we might have actually time, or we might even end a little bit early. And just to apologize, IRC is not able to present today on the CASI. We had said that last time, but they had a conflicting meeting that they needed to attend. And then Mendy Marsh was supposed to present last time and couldn't for personal reasons. And unfortunately, she's traveling today, so she can't present this month either. So we'll have to see. We don't want to have a too packed agenda for our next call. So we'll be letting you know what's happening on that next call. So I think we can go ahead and start. We have 38 people. There might be a few more joining, but welcome all of you who have joined already. And I'm going to turn it over to Kate.
Thanks, Jennifer. Hi, everybody. My name is Kate Rougvie, for those of you who don't know me, and I'm the interagency coordinator for the GBV IMS global team. So I was just planning today, since it's been a minute, I think, since we've had a kind of global overall update from the GBV IMS interagency global team to the AoR. It's just an opportunity to update you on where we're at and kind of what we're looking at in terms of priorities for this year, and obviously to have a conversation with you and see if there are areas where you think we could be taking advantage of synergies more. So let me share my screen. Okay, is that visible to everybody?
Yes, it is.
Confirm. Fantastic. Thank you. Let me move all of the Zoom junk out of the way. All right, so I'm sure that everybody is quite familiar with the GBV IMS and the interagency team already, but for anybody who is less familiar, it is, of course, an interagency team at the global level that's made up of UNFPA, UNICEF, International Rescue Committee, International Medical Corps, and UNHCR. So all of the work that I'm going to be talking about for the next few minutes is really englobing all of the contributions in the work of those agencies. At the global level, there is a steering committee made up of those agencies, which is kind of the overall governing body for the work of the GBV IMS. And then we have an interagency, well, some interagency, some not interagency technical team, which really does, all of the operationalization of that work. So let me dive in. So if I were to kind of group the priority work areas of the GBV IMS global team, this is, I think, how I would kind of separate those things out. There's always a lot of overlap and obviously a lot of synergy between those areas. We have a lot of work ongoing on the GBV IMS basic tools. Now, for those of you who have followed the GBV IMS since it began back in 2006, you'll be familiar with the basic tools. That's the original legacy system which is offline, which was developed to promote the safe and ethical and quality collection and analysis and sharing of GBV incident data by direct service providers, and predominantly by psychosocial support service providers and case management personnel. So that's one area of work. Then we have Primero GBV IMS Plus, which I'm sure you've also heard a lot about, which is the latest version of the GBV IMS, if you like, that began development back in 2013 and has been rolling out more and more since 2019 to interagency contexts. And that's our online case management and incident monitoring system. So the both technological and programmatically more advanced version of the initial GBV IMS. We have a whole packet of work around GBV case management, which focuses on capacity building and resource development, targeting GBV case management personnel. And then we have an area of work that focuses on data analysis and coordination with other systems. So really they're looking at how we harness the GBV incident data that is gathered using the system to be able to analyze that and integrate it into decision-making around programming and coordination, ultimately to improve the quality of care and our response for survivors of GBV. So where are we at the moment? If you look at this very, let's just say, indicative map of where we're rolling out just now, if you group all of those different areas of work, so across the case management, GBV IMS basic tools, GBV IMS Plus, and the data analysis support, we're currently providing technical support to around 26 countries. Within or amongst those, there are 17 countries where GBV IMS and or GBV IMS Plus are being rolled out. Sometimes that can be just GBV IMS Plus. Sometimes that can be coexistence of GBV IMS and GBV IMS Plus, and others where they're still working with the original legacy GBV IMS. There is a cumulative 7 countries that have received targeted case management capacity building support. That's going back since from 2016 to 2020, and a total of 4 regions targeted. So if you are interested, I can give you the list of countries that we have been supporting. So in terms of active ongoing support, we support the Central African Republic, Cameroon, Mali, Niger, Nigeria, Iraq, Jordan, Lebanon, Libya, Somalia, Yemen, Turkey cross-border response for Syria, Kenya, Uganda, South Sudan, Ethiopia, Bangladesh, Myanmar, and Tanzania. And then in terms of contexts that we're currently in discussions with around potential rollouts or looking at assessment for rollouts, whether that be in terms of case management capacity building, GBV IMS Plus rollout, or a combination of those things. We are in discussion with Burkina Faso, with Mozambique, with Armenia, with Afghanistan, with Sierra Leone, Philippines, OPT, and Sudan. So just to give you an idea of the kind of geographical coverage that we're looking at. Just some kind of overall stats from, this is from our 2020 results monitoring. We have, as of the end of 2020, we had 103 user organizations using GBVIMS and or GBVIMS Plus, of which 31% were international NGOs and 69% were local NGOs. We have at least 12 different UN entities engaged in the GBVIMS, and that can be in some cases as a user organization, in cases where UN agencies are providing services directly. For the most part, it's the engagement of UN entities in coordination roles, in providing technical or human resourcing support to the rollouts of the systems. There are a total of 16 different government entities involved. Some of those are multiple different government entities within one single country. And that kind of engagement can range from being a user of the system where services are being provided directly to playing a coordination role and supporting data analysis and in that process. We have, as of the end of 2020, a minimum, I say a minimum because I think my data is still missing 1 or 2 countries, but a minimum of 165 different unique organizations, international and national government, UN, etc., who have signed on to information sharing protocols for the safe and ethical and quality analysis and sharing of GBV incident data, which is a huge achievement. In 2020, we, across all of these countries, the teams were able to hold at least 131 coordination and analysis sessions, produced at least 211 GBV incident monitoring reports. Over 800 people were trained on GBVIMS and GBVIMS Plus. That's including over 100 different organizations. And at least 106 people were trained on GBV case management, and that's including both training of trainers and step-down trainings that were then carried out by those trained trainers. So in terms of looking at those different buckets of work for this year and what we're focusing on, for our GBVIMS basic tools work, we're continuing support to the 16 active GBVIMS basic tools rollouts. And we're also currently working on the development of a GBVIMS basic tools e-learning, which will hopefully help us in being able to kind of better target some of our in-person support and in-person trainings when those pick back up again. Because we have a lot of countries where, as we know, in humanitarian response situations, we often have a lot of staff turnover. We often find that we need to carry out refresher trainings on basic tools trainings to the same countries on multiple occasions. So we're hoping that the e-learning is going to be something that will help us be able to provide that access to refresher training with less reliance on deployment by the team. And it's also something that will be able to kind of help organizations who are planning to access GBVIMS Plus to develop a grounding in the kind of principles and processes that govern the use of the basic tools that are integrated into GBVIMS Plus. In terms of where we're at with GBVIMS Plus just now, we have 8 active country rollouts. There are a total, and I think this was as of, I want to say as of Q1 this year, of 815 case management personnel using GBVIMS Plus, working within 36 different organizations. And we're looking at hopefully another 4-ish, maybe more, interagency rollouts planned this year. So we are currently in discussions, for example, with countries such as Armenia and Afghanistan as potential new rollouts for this year. So we will certainly keep you posted on that. In terms of the different areas of work for GBV IMS Plus, obviously we're continuing that ongoing support to active rollouts and to new deployments. And that can be anything from, having very initial conversations with actors in country. We can have individual organizations contacting us, asking more about it, linking up with the GBV subclusters and subcluster coordination to be able to provide more comprehensive information about the system to the subcluster memberships. And then from that all the way through the assessment, planning, implementation, and maintenance phases of those rollouts. The GBV IMS Plus e-learning is also, I think, I want to say almost finalized, though anybody who is online from the team who wants to jump in and say when, please go ahead. But as far as I know, that is almost done. And the translation, I think, into Arabic is due to be completed in the next couple of months. So that's really exciting. There is also a GBV IMS Plus companion guide, which is under development and I think is due to be ready around July. And that's really looking at bridging guidance around case management good practice and the way that GBV IMS Plus can support case management. The French and Arabic translations for version 2, that's the latest version of GBV IMS Plus, are almost ready. So obviously that opens up a lot more possibilities for more rollouts. I did want to just shine a light on a couple of the really cool features that you might know less about in GBV IMS Plus. It's by no means an exhaustive list, but some really, really great kind of new elements to the system include the integration of key performance indicators for case management quality. So while our GBV IMS incident data allows us to look at, an analysis of the nature and the type of GBV that's occurring in a certain context and what our response to that looks like so that we can improve that response. The KPIs around case management really dig into key performance indicators for service quality. So individual organizations will be able to access that automatically updated dashboard of key performance indicators to be able to improve their quality internally. It also integrates psychosocial support, psychosocial outcome scales. These are from IRC's psychosocial outcome monitoring toolkit. Forgive me if that's not the correct title, I think it is. Which includes, for example, a psychosocial functioning scale and a felt stigma scale that are built into the system. And we're also, the system has a client feedback role integrated into it. So meaning that we'll be able to systematize the way that we gather client feedback, but also in a way that's going to be honoring and respectful of the guiding principles and good processes for gathering that. And the way that we can harness those features is going to be outlined in that companion guide. Other new and exciting developments, after a few years of many requests from government for support in looking at rolling out GBV IMS Plus, the GBV IMS Steering Committee has now mobilized resources to bring on 2 consultants. So one consultant sitting with UNICEF that's already started with the team, and a consultant with UNFPA that will be coming on in a couple of months to look at developing a model for rollouts of GBV IMS Plus for governments, and then also looking at piloting that in 2 countries. So that's also a really exciting development. And we're also working on starting a project looking at how we could extend, or if we can extend, GBV IMS Plus to meet the needs of health responders providing clinical management of rape and intimate partner violence response. That's going to start with an initial review and scoping and formative learning phase before then looking, hopefully, at developing and piloting that adaptation next year. So we will keep you posted on that too. I can't see the chat, so I'm sure I'm over time, but I will go quickly to the end. In terms of our case management work, we're lucky to have two specialists dedicated to case management work who are sitting on the GBV IMS technical team. They're providing ongoing support to the global pool of case management trainers, which is currently sitting at a total of 148 plus another 15 incoming, providing technical support to interagency case management capacity development efforts. So for example, we had a really great example recently of interagency collaboration and leveraging that capacity. There were, I think it was UNFPA and UNICEF in the Gambia, where they had mobilized resources to roll out case management training and training of trainers in the Gambia, but we're struggling to find the capacity necessary to run those, facilitate those TOTs. So we were able to work through the global pool of trainers to identify 2 certified trainers from another country. So these were 2 trainers that were at this point working with WFP and UNICEF in Nigeria, and working together across those agencies, we were able to have them mobilized. They were borrowed from UNICEF and WFP in Nigeria to carry out this short training mission in the Gambia. And through that, we were able to support them through that kind of initial assessment and then review of the certification process, and now have another 15 certified trainers who will be able to join the global pool. So we're hoping that that's something we can continue to look at as a resource in the future. There are plans underway for new rollouts of the case management capacity building initiative, including a potential 10 new target countries. I'm going to wait until I think possibly the next GBV AoR meeting, where our case management specialists will be able to provide a more detailed update around that. The GBV Interagency Case Management Guidelines e-learning is under under development, hopefully ready by September this year. And I also just wanted to highlight a few contexts where we've had a really great collaboration with the Riga. So the Gambia example was a collaboration with the Riga, the regs in West and Central Africa, equally with Burkina Faso, and looking at, for example, planning for case management capacity building in Libya has also been a great team effort with the Riga for Arab States or MENA. And then lastly, in terms of GBV data analysis and collaboration with other systems, a lot of our ongoing technical support work involves building capacity on data analysis. We're continuing to work very closely with UN Action around conflict-related sexual violence data sharing and analysis between the GBV IMS and the MARA. The team is looking at how we can strengthen and data visualization through, for example, the recruitment of a data artist. And we're also looking at the possibility of piloting a regional data analysis for GBV IMS countries. That is everything from me. Sorry, I think I went over time. For more information, of course, you can visit our website at gbvims.com. Thanks.
So Kate, I have 2 questions, and we don't have a lot of time. You went twice as long as 15 minutes.
Sorry.
But one question was coming from Irina Dawa, who had a question about what do you need to do to become a certified GBVIMS trainer? And then we also have a question from Ashley, who is asking if you could talk more about the GBV IMS Plus for health CMR IPV providers, and has there been discussion with health providers or teams within GBV orgs about their engagement? Any feedback?
So for the first question, in terms of access to training opportunities, usually that's linked to countries where the GBV IMS is rolled out. So if you're working in a country where the GBV IMS or GBV IMS Plus is active, please do get in touch with your subcluster coordinator, who will be able to tell you about any planned or ongoing training activities. We do occasionally have regional or global training of trainers activities. Don't think we have any of those planned for this year, but we will make sure to circulate that through the AoR if that surfaces. In terms of the GBV IMS Plus for CMR IPV health response, this is in a very, very early stages, and we plan for the first phase of that project to be entirely focused on formative learning and consultation. So you won't have heard a lot about it quite yet because it's so new, but we will certainly be looking at mapping all relevant stakeholders across GBV through the protection cluster and GBV response, particularly CMR IPV response through the health cluster and any other interagency working groups. If you're particularly keen to be involved in that, please do feel free to, you can reach out to the AoR who can put you in touch with me. Thanks.
Also from Save the Children, I didn't say that Ashley is from BHA, didn't say that, sorry about that. So Nina from Save the Children is asking about guidance for child protection actors who are providing services for child survivors, and sort of what's the interplay between CPIMS and GBV IMS.
Kate, you're on mute.
Sorry, yeah. It's a great question, and certainly one that we're always discussing. GBV IMS and CPIMS Plus, and indeed GBV IMS Plus and CPIMS Plus, are rolled out under different kind of coordination and governance bodies, but we do regularly coordinate and discuss with the CPIMS coordination to see where we can enhance synergies. And one of the things that we're looking at in that, and one of the benefits of having GBV IMS Plus and CPIMS Plus on the same platform, means that there is the possibility to have interoperability, or essentially those two modules talking to each other, which should enhance quality of care and coordination. However, I would say Cassie is probably your best bet in terms of more detailed information around ongoing work on the GBV CP coordination front.
Thanks, Kate.
And then we have Louise from IOM. Afghanistan told me they thought they were going to need a little bit less time than what we're giving, so I'm banking on that. You have to be careful what you tell me. So I'm giving Kate an extra 5 minutes to answer these questions.
Don't worry.
Okay. It always takes more time than we think. It's great that people are asking questions, though. It shows there's a lot of interest in GBVIMS. So we might have to have Kate and her steering group, the others. I know we have Catherine on the call as well from UNICEF for a future call. Anyway, so Louise from IOM is asking about if there's specific criteria for the GBV IMS for government and where to find this. And by the way, you have two folks from Colombia, both an IM and the coordinator on the call, because I know they've been asking a lot also about, how can this be done with the government? And I've heard people using the terminology of hybrid GBVIMS, which I don't know if that's an official term or a way to avoid getting approval from all the steering committee. So anyway, back to you, Kate.
Thanks. Yeah, I mean, great question, and that's essentially what we're trying to figure out this year. And the consultant that has just joined our team in the last couple of weeks from UNICEF has already started diving into a review of, you know, all possible literature and consultations to begin that work. But the idea is really to develop those criteria, to see kind of, you know, what the minimum acceptable, you know, minimal viable packages are in terms of quality and safety and ethics, and figuring out accountabilities for those things as well as the, you know, the logistical sides of rolling out that system. And that's going to be a, you know, a big piece of work. So that's just starting now, but we'll be, of course, more than happy to share all of the resources that come out of that. I hope it'll be a, you know, really big learning experience this year.
And you did get a few compliments. Ashley from BHA said she's very excited about this update. And now we have Constance from one of the steering group UNHCR members who just wanted to say what a great job in organizing the IMS task team and all the work that the steering committee has done during COVID, and in particular, getting critical materials up and out. So, and actually, Catherine also put something into the chat, some statistics. Step down trainings following the TOTs on case management have enabled over 3,000 people to be trained, and these continue. So I remember a couple years ago when Kate was trying to figure out how to address this huge gap around case management. And I would say fabulous that you guys are reaching so many people and able to do all of this work around case management, because it has been a huge gap in the GBV world. So kudos to the whole steering group, and thank you, Kate, for this presentation. Any last comment before we switch over to Afghanistan? We're actually not so bad on time. We'll still have a good time for Afghanistan. Any last question or comment? I know we do have steering group members, so if you want to say something other than what was in the chat, if somebody wants to speak up, feel free. Okay, so it seems like we have it covered in the chat. Great, thank you, Kate. We might have you come back again. It was a very engaging session. And actually, I think there are a number of people who have questions around engagement with the government. So that might be a whole topic that the GBVIMS team could come back with and discuss at some point. So I would like to introduce Elisa Cappelletti. Did I?
Perfect.
Her your last name? Okay. She is our coordinator in Afghanistan, and lovely photo. She's going to present the situation, and yeah, we're, I think, quite concerned about the situation currently in Afghanistan. And as the US troops leave Afghanistan, I don't know, you know, what the near future is going to look like, because there's been a lot in the news about I think especially the girls that were recently killed in the school. So I don't know what you're presenting on, but I think we have been hearing recently about Afghanistan some very tragic news. So over to you.
Thank you very much, Jennifer, for this possibility, and thank you even Shiva for the logistic support now with the presentation. So today we are here to speak a little bit about Afghanistan and our situation, and unlike Kate, I probably won't be receiving questions, but I'm gonna ask you questions and some way forward if we can brainstorm together. So we can go to the next. I'm gonna speak briefly about the humanitarian situation. As you know, Afghanistan is 40 years of war, natural disasters, poverty, COVID-19 that are impacting the people of Afghanistan. The conflict is indeed causing physical and psychological harm, and is forcibly displacing hundreds of thousands of people from their homes. from 2020 up to now, we have almost 500,000 people that have been forced to flee from their homes. And of course, civilian casualties remain high, with women and girls being those that, women and children being those that are continuing to be disproportionately impacted. Now, when it comes about COVID-19, it did have indeed catastrophic consequences on health of the people, but even on their incomes and livelihood and the levels of debt. So on top of that, hunger and malnutrition have spiked with the conflict and the economic downturn. Although the drought has not yet been officially declared, but the situation is definitely not going well for the population that are already struggling to cope with the impacts of COVID-19 and the high level of food insecurity. The markets do continue to function, but the price for the commodities are elevated compared to pre-pandemic levels, and the purchasing power of both casual laborers and pastoralists is pretty much low. So what we are expecting is that affordability of food is likely to be a stress for households over the next month ahead. So this is our humanitarian framework. When it comes about the political one, if we can go to the next, Shiva, please. Although there is a very strong political will to achieve peace in Afghanistan, there have been significant delays in the intra-Afghan peace negotiation. The withdrawal of NATO and US forces has been put forward as a part of the comprehensive roadmap for peace. And allegedly, the troops are going to leave the country by not later than the 11th of March. Of September. Now, what this is a decision that is delayed indeed from the initial date of May 1st, and this is likely to have a significant impact on the security in the country. So already, next please, in the HRP and even in the contingency plan that we have done for the spring disaster, we did anticipate of a worsening of the conflict situation during the year, but we were not expecting such a rapid deterioration of the security situation. So next please, what we know is that past large-scale urban conflicts have shown that women and girls and children are at high risk of displacement because the older people and the men normally remain back and stay put in the city either to defend their property or to join the fight, or because they are physically less able to move. During the displacement, we know that women and girls are at higher risk of hunger, undernutrition, or health condition because the cultural norm do prioritize the feeding of male family members in times of stress. And of course, next, there are the usual risks of sexual and gender-based violence that are always high in conflict situation. The humanitarian community as well, and recently a meeting that we had with the ICCT, we did recognize that the vulnerabilities of women and girls might be overlooked and not addressed in the humanitarian assistance if we do not include female staff at both assessment and response level. Now, if we move forward, we know, and we are going to touch now what has happened recently. So in the first and second quarter of 2021, the security situation, as we were mentioning, has experienced a spike in the level of insecurity with tragic gender dimensions. As Jennifer was mentioning, in May in the beginning of May, we had the attack on the girls' school. 80 girls lost their lives. We had before attacks on health facilities that were targeting female workers, with the killing of two women that were doing polio vaccination campaigns. And already in the first quarter of 2021, the report on protection of civilians from UNAMA identified a worrying trend of killings targeting civilian women. So next. Now, what we are picturing here is a two-folded scenario. Either we have a conflict scenario or we have a peace scenario. In the conflict scenario, we are going to go with the straightforward emergency model, which is saving life in the immediate period of the emergency that is following the escalation of the conflict. And in that case, we will be prioritizing GBV specialized service, life-saving specialized servicing, case management, psychosocial support, legal services, sexual and reproductive health. Now, in the areas of conflict. In the peace scenario, instead, it's going to be a little bit more complicated because we are considering what is going to be at loss in here, because if there is a peace, what we know is that most likely women and girls will not be allowed to have the same freedom of movement that they are somehow given now. So we do acknowledge that a full suite of services that are targeting women and girls must and should be delivered, but it might be even tricky to call these services GBV. And the terminology might have to be changed, and we might have to piggyback on already existing services in order to be able to implement GBV programming. We do know that GBV should be mainstream throughout the response, even if this is not going to be used as an element of negotiation. Even if we are not emphasizing this in the negotiations, of course. Next. So, as we were mentioning before, the situation is kindly catastrophic in this moment, because at the end of March 2021, the fund tracking system was saying that the GBV components of the Afghanistan HRP were funded 0%. So this means that now, when women and girls need it the most, partners might have either to scale down, to close or minimize their services. We are still functioning on some carried over funds from 2020, even when it comes about our emergency kits. But this doesn't, it can't last, especially now with these dire conditions. So what we are doing now, and I came to the conclusion of my presentation, if we can go to the next, our response for the time being is, well, we are creating operational tools for the cluster members. We have recently created checklists, something for the partner to be able to know whether they can or cannot perform immediately and what are the actions that they can do. There is a WASH and GBV checklist, which will allow us to mainstream GBV in WASH response. We have created a contingency plan checklist with the key actions that partners have to take to be prepared for an emergency. We are trying to mainstream gender-based violence in all the sectors. We are doing capacity building of local actors, and soon there are discussions which will soon end on the creation of a GBV case management training for first frontline responders. We are strengthening the referral pathway, and we're working on advocacy. And today we presented at the GBV Sub-Cluster this morning a funding advocacy paper where we are requesting for immediate funding and support when it comes about the life-saving GBV services. And with life-saving, we mean integrated even sexual and reproductive health, so health in GBV and sexual and reproductive health. But as well, we are asking for funds for GBV coordination, because we are not in a position now to monitor the trends with coordination's role being linked to AHF allocations, Afghanistan Humanitarian Fund allocation, which are, of course, emergency allocations, so limited in time and space. And this is causing challenges, because now at the time when we need to be able to know what is happening, where and how we can support immediately, we are lacking this function. So we are asking for support for the national role of the coordinator, for the co-lead, co-chair of the GBV Sub-Cluster. We are asking for support for regional coordinators, and indeed I am, because that's what we need the most. Basically, this is where we are. And to conclude, my question to you, what more can we do? I'm not entirely sure if there is somebody from Yemen, for example, in here. I'm thinking about active conflict scenarios, and know how you guys are managing the situation and how you're moving forward. So this is my request for you for a support. Over. Thank you very much for listening.
Thank you, Elisa. I don't see any questions in the chat, but is there anybody who would like to just turn on their microphone and ask a question? If not, I had a question. You mentioned about needing to have women engaging in the assessments. Are you talking about as staff?
Yeah.
Or assessing women, like that the women are not being assessed, or you're talking about the...
Well, it's both, because it becomes, when you have a very heavily dominated male response, we do have challenges then in reaching the target of talking with women and girls. So the moment that we are not hiring enough female staff, it's because we don't have a lot of funding even for staff overall. We are facing huge challenges in understanding what are the challenges that women and girls are facing. They tend to be neglected. So this is what I meant by it.
Yeah, I remember this issue in Afghanistan, that a lot of the organizations, both UN and NGOs, INGOs, were challenged to hire women. And I wonder if, that I was, yeah, it was some years ago, but I'm just wondering if that's improving at all. I mean, I feel like a lot of times it's an excuse to not have women on the staff. And I know it is harder, and that more effort needs to be made, but I'm wondering if that's a situation that's improving, if organizations are making those efforts and are able to look for ways to hire women so that they can speak with other women, as you mentioned.
We're still facing challenges. It's very heavily male dominated. Even the GBV Sub-Cluster meeting has a lot of males, and I'm very happy, that we have men working in GBV that are supporting the feminist cause, no? But at the same time, it proves to be difficult to then talk to the population and the people that we serve. So we are still facing the challenge. I will check even with UN Women, because they were doing a sort of analysis of presence of gender balance within the humanitarian workers, but it's not finalized yet. But we are far from 50%.
Yeah, I'm not. Yeah, I remember doing an assessment there, and yeah, some organizations that did better than others, but definitely there needs to be more effort. So now we have some questions. Catherine Poulton, who's from UNICEF, is asking if you can say a little about coverage and access for the trainings, etc. And then Ashley from BHA is building on Catherine's question and asking if you could speak to the capacity of GBV providers on the ground, specifically on response of both INGO and local actors.
So we do have quite a lot of actors that are operating on the response, and there is a strong willingness of the local actors to be fully invested in understanding what GBV is and how to respond. The subcluster has started last year, and we're continuing with some episodes of explaining the minimum standards, and we have bilateral requests even to do capacity building on specific topics for specific actors. Recently, we have done together with the CPAOR a training on caring for child survivors that was targeting frontline responders. So there are these kind of initiatives, and access to the training. We are doing trainings in person. The caring for child survivors was in person. There are as well some trainings on PSEA that are face-to-face conducted. It's proving to be a little bit difficult when it comes about language. Dari and Pashto translations are not always up to the correct definition, so we are still working on English trainings when we know that the majority of the operators instead should be operating in Dari and Pashto. So we are trying to do our best, and now we are in the process of doing a sort of interagency organization for the GBV case management training, and that is a process that is led by the GBV Sub-Cluster together with UN Women, UNFPA, IRC, IMC, and then we want to involve even some members of local NGOs to do the training for GBV case workers, and we would like to hire a consultant that will do the training, but at the same time will be accompanied, with another local trainer that has language skills, so that we are trying to bridge the gap that is existing. So we do have some capacity. Of course, we're working on the capacity building because that's the only thing that we can do now. We are all humanitarian actors will be staying at the time of conflict, but we are just wondering how much will be the capacity to access and to respond, and we are trying to work on at the level of frontline workers to ensure that we're covering that part. I hope that this does answer the coverage and the access for training and the capacity.
Yeah. So Tema, who's our Riga, has offered to put you in touch with the Yemen colleagues in the future, so you can talk to them. They're not on this call. I saw we had a few people from Bangladesh, but we don't have anyone from Yemen. And then NCA is thanking you for the presentation, and they mentioned this issue again of hiring women in their GBV program in Afghanistan, and that challenge for multiple reasons. But they have a GBV specialist arriving in Kabul this week to support the program, so they will put that person in touch with you. So that's good news. Another team member on the ground to join. And Nina from Save the Children is saying that actually Save the Children has been implementing a pilot in Afghanistan to recruit, retain, and promote women. And it would be interesting and great to hear if other organizations have learning on this, what approaches have been taken to simultaneously avoid putting women at risk of harm. And Nina, just to say, I mean, it's been a while since I've been to Afghanistan, but I went there on behalf of NRC, and they actually were doing quite well. They even had a team, an ICLA women lawyer team that was working at that point. So it would be interesting, I think, to check with NRC. I don't know how they are now, but they a number of years ago were doing quite well compared to other organizations. And I also remember talking to women that a lot of the reasons why they weren't working in Afghanistan was about sexual harassment in the workplace, which seemed to be a huge issue. So that might be an important consideration when looking at why women don't take the jobs. And then Philippe is asking if there's a role for international advocacy through the PARG group that can reach, help meet these gaps with an external audience. So
That's not a question for me.
I know. I was gonna say.
But perhaps if I can, so today we had sort of approval that nobody complained at the level of the GBV subcluster, so we took the silence as an approval for our funding advocacy paper. It's totally a one-pager, so perhaps if I can share it with the team and we can sort of push it a little bit. I'm just wondering if this is something that we could be doing.
Great. So, and it sounds like it'd be interesting for organizations to be in touch with Nina from Save the Children to hear more about this pilot that's going on, because I think, you know, it's too easy of an excuse to just say we can't hire women. It's too complicated because of the culture or whatever, but really look at meeting those challenges and seeing what works and what can be done and putting more effort into it. Because I think it's a very good point that in Afghanistan, where it's already so difficult for you know, clearly women talking to women is the best way to go, especially on GBV. It would be very hard for women to speak to men on GBV. So I think, you know, having women on our teams, I know CCCM has done a lot on this in different places as well, of looking at getting more women participating in camp management and actively working on that issue. They did some work with WRC. So I think there's some examples out there, but good to know that this pilot is going on. I think that's it. So, so Emily Sue, who is from the GBV AoR, so that UNDP's also conducted studies on gender equality in public administration that has findings related to Afghanistan that might be worth looking at. This includes identifying barriers to women's participation. Some of the areas include police, justice, etc. So something else that could be looked at. But just to reiterate what Elisa said, funding is, you know, a major issue. She said, you know, a lot of the funding ended in March. So I think this is important to take note of and to think about what kind of advocacy. You know, we will look at having the PARG provide some support, but if any of those of you with connections to donors or who have ideas, and of course looking to connect Elisa to other countries. I know sometimes other coordinators. Elisa just started in January, right? Was it January? Yes. So she's still new, fairly new. Big steep learning curve. So and she's very eager and motivated. So if people have suggestions, please feel free to also get in touch with Elisa.
Thank you very much.
Any final words from your side?
No, thank you for this opportunity.
Great. So so that's it. We're perfectly on time, which is great news. Thank you so much for that update. Oh, wait, we have IMC has a good number of women staff now in the GBV team. They've been implementing more for a decade. It's true, IMC has been there a long time, and Camila and the team might have some lessons to share. That's a very good point. I see it says iPhone. I'm guessing that's Micah. And a thank you from Catherine. Yeah, I feel like Afghanistan, we know, also suffers from donor fatigue, but it's challenging times coming up, and we can't forget about Afghanistan because there's so much still going on, and donor fatigue can't be the reason to not care about Afghanistan. So yes, Camila, if you don't have her, I'm sure you have her information. But if not, we'll be happy to provide that as well. Thank you for those inputs, Micah. And I think that's a good conversation to be had. It's true. IMC's been running one-stop shops and all kinds of things in Afghanistan in different regions. Great. So we've also now been asking for an update on Mozambique because this is another area that has been most recently in the news, and we have Harriet Adong, who you might know from having seen her also when she was in Nigeria or Bangladesh. She's been on the Surge roster and worked in a number of countries. And this is actually, I think, her going back to Mozambique. She was there when Jessica Gorham and Luana were there during the times of the natural disaster some years ago. So Harriet, I'm gonna hand over to you, and we should have time for questions and answers at the end as well. I think we're right on schedule. So over to you.
Thank you so much, Jessica. I'm just going to turn off my video so that I can be able to maximize my internet as well. So thank you so much, everyone, for having me. I'm just going to share with you what we have in Mozambique right now, and basically be able to give you highlights of what's happening in Mozambique, where we are, and what we're looking forward to. So Mozambique is southeastern of Africa, and it's by the Indian Ocean. It has 11 provinces as of now, and it's actually very prone to cyclones because of the Mozambique Channel. We've had cyclones in the past 2 years. We've had Cyclone Idai in Sofala. We've had Cyclone Kenneth in Cabo Delgado, which is our focus right now. And we've also had a conflict situation, which is still continuing since 2017. And that has continued to increase vulnerabilities of communities. And before these happened, definitely there were other development and social challenges that Mozambique had. Now, the humanitarian situation in the first quarter of 2021, we had very difficult situations of conflict, where we had a district, for example, right now, Palma, with serious conflict situations, and you find that women and girls are abducted, and some humanitarian or even company workers are still missing. And so all these have continued to increase and heavily impact on humanitarian response. The insecurity, the climate shocks, the COVID-19, and administrative challenges still present us with very limited chances of reaching out to communities. So the lack of access, which also is exacerbated by increased displacement and the increased human rights violations. Yes, we know for sure that we're in an area with a lot of climate shocks. So the heavy rains are limiting movement of humanitarian goods to specific areas. And we also have very serious administrative challenges, where we've seen over 70 visas for humanitarian workers are still pending. And that explains why most of us are still on remote assistance waiting to be deployed. Now, the displacement situation is really difficult. We currently have 697,000 internally displaced persons. Now, Cabo Delgado, which is in the north of Mozambique, close to Tanzania, is hosting 630,000 IDPs. Now, the districts that are really heavily hosting IDPs is Pemba, which is the capital of Cabo Delgado. Then we have Metuje, we have Mueda, we have Ankwabe, and Montepuez. Now, you will note that in some areas we have transit locations. In other areas, we have internally displaced persons hosted in communities, and this comes with its difficulties as well. I bring you a quote from one of the ladies who spoke to a UNHCR protection field monitor, and she said, "Nowhere in Mozambique is safe anymore." Now, 7% of households agreed that they had female survivors of GBV, while 67 of them in Mueda did not know how to access GBV services. And when you ask me why, it's because in certain areas we don't even have humanitarian presence. 37% of women experienced violence according to national statistics. Yes, we know for sure that the conflict has been able to present a lot of difficulties in terms of abductions, in terms of physical violence, psychological abuse. And sometimes when we move forward and the DTM teams get to visit they heavily report issues of psychological abuse, issues of physical abuse, and this is very difficult. While we know that sexual violence has not always been reported, we keep seeing that some ladies who have been kidnapped and girls often return back when they are pregnant. And this is a very difficult situation as well. Now, in host communities and also those residing in transit areas, we have noted that there are issues to do with early marriage. And so the number of interventions that are still underway by key protection actors and GBV AoR partners, which will, I think, yield fruit to that. Now, sub-cluster partners, currently moving on, we have about 20 partners or over 20 partners. We have the government, where we have the Provincial Directorate of Gender, Children and Social Action. We have national agencies like WIWANANA, FDC, Mlade, ADEL, QUAM, AMODEFA. International agencies like CARE, Save the Children, Caritas, MSF. I must note that MSF is the only partner that is able to go to places that we cannot go to. And so sometimes we really bank on them for lots of information, for lots of support on provision of IEC materials. We have MDM, we have NPA, NRC, ABC, and Plan International. And the regular UN agencies like UNFPA, UNICEF, UNHCR, IOM, WFP, WHO, and UNOPS. We are now beginning to see interest from UNOPS coming to provide more assistance on GBV. Now, our partner response actions in Cabo Delgado are as limited as these. We have dignity kits to targeted women and girls. We have about 10 women and girls safe spaces. We see partners doing awareness raising on GBV and also the referral pathways, the psychosocial support and referral to services, the mental health and psychosocial support by IOM, the mobile brigades that provide health and also medical support for survivors of GBV. And we have one partner that provides legal assistance to GBV survivors. Now, our donors, we have one strong donor that has been consistent, and that is the SAF, that has been providing us with the most funding. We also have funding from Canada and Norway, and we have seen interest from Japan and China coming to the table to be able to provide us with more support on funding. Now, this is where I want to dwell more on this, where you see the red mark is where we don't have any partners. Why? Because these are the areas with the most insecurity, that is Palma, Mocimboa da Praia, Medumbe, Macomia, and Kisanga. Now, in 2019, when Cyclone Kenneth happened, these were the areas that were affected most, that is Kisanga, Macomia, Palma, Mocimboa da Praia. And so barely when communities had actually barely recovered from the cyclone, and then now we had the sporadic displacements due to the conflict. And now, as I speak, Palma has been the major source of conflict, and we keep seeing more and more communities coming down south to Mueda, Meluko. If you note that in my previous slides, we had specific communities districts that were hosting more IDPs. So we have Mueda, we have Pemba itself, and so you find that as much as we would like to have a lot of services in these locations, we definitely have some challenges. In some locations like Namunu, Nangade, and Meluko, we don't have any partner at all. And where we have a partner, definitely we have some specific challenges of funding, and that brings us to very difficult situations. Our highlights, definitely, we know that we have had a 25% increase in membership to the AoR. We have revamped our AoR with a strategic advisory group that has a total of 8 members. And we have also an action plan to support our coordination activities. And we also have the Women and Girls Safe Spaces that are operated by UNFPA through its partners and also by CARE. We've had very elaborate support from the regional office in terms of the regional emergency, the REGA herself, and also the Rougvie GBV emergency program specialist and the GBV information management officer. We've also had very substantive discussions with the interagency teams at global level on GBV IMS. Now, our subcluster priorities are very direct. In Cabo Delgado, we have problems of service provision. And why we have problems of service provision is because we have limited partners providing specific GBV response. And so we want to focus more on increasing GBV case management, which we don't have currently. But in the next 2 months or so, we'll be able to have specific partners provide case management with support from SAF. We also want to strengthen technical capacity of the subcluster partners. While we have lots of national partners, it must be noted that their capacity also needs to be strengthened in GBV programming. We want to improve our evidence-based programming. If you will note, not so much has been brought out about the GBV situation in Cabo Delgado. We've had a number of assessments far back as 2019 and then 2020, early 2020. But now we want to really improve that evidence-based programming and make sure that we are able to respond accordingly. We also want to increase the funding base. Yes, as much as we have partners present whose capacity may be limited, but that can be strengthened. We also know that they don't have a lot of funding, or they have actually insufficient funding to be able to move forward and provide meaningful assistance in communities. And we are also looking at the advocacy bit of it, where we want to be able to work with the government as well. We want to be able to work with specific donors and also on key thematics, especially child marriage and early marriage. Now, our challenges, yes, the insufficient partners, both national and international, with specific capacity to implement GBV programming. If you looked at the partners that I presented to you, if the international partners, currently we have CARE International and we have Save the Children. And these are the two partners that we can sit back and say, yes, if we have funding, we could give them and they could carry on with support on GBV programming. Otherwise, we require more international partners to the table, and the national partners that are present, as much as we can be able to work with them, they still need a lot of support in terms of GBV programming. I noted earlier that there are funding gaps for agencies with technical skills. Yes. Even the UN agencies like UNHCR, IOM, UNFPA, still the funding is inadequate. And basically, if we can be able to bridge these gaps, then we can be able to have more meaningful assistance in communities. The evidence-based programming and information management by partner members also requires support, because sometimes you can be able to ask for so much, like the service map that you saw only has a few partners. And why? Because specific partners may not be able to provide any more information, maybe because they don't have funding, or maybe because they don't have the support as well to put that to the table. So moving forward, we would like to prioritize funding for partners delivering evidence-based GBV programming. And we also want to advocate for more international partner presence to support GBV response in Cabo Delgado. Why? Because they work with minimal support, and they know what to do, where and when. We also want to encourage donor engagement with the GBV AoR subcluster so that we can be able to have a win-win situation on the ground. Thank you so much for listening to me. Over to you.
Thank you, Harriet. I'm not seeing any questions yet in the, yep, here we go. So, oh, and by the way, I wanted to just note that we have a visitor today. We have Carmen Valle from the ISC MHPSS reference group. So it's nice to see when people join from other clusters or reference groups or some of the other groups that we interact with, but who are a little bit outside of our specific GBV area. So Carmen is saying that she's well aware of the ongoing collaboration and coordination with the MHPSS technical working group, both in Afghanistan and Mozambique. And she just wanted to add that in Mozambique, they're sending a colleague who's going to be deployed from the reference group, Dutch surge support, to continue supporting MHPSS interagency and cross-sectoral work. That's great news, Carmen. So thank you for that. And I think also, we are aware that it was before COVID that the Dutch decided to support this roster. So it will be interesting to see how that goes, because I don't know if we've heard much about people who are going specifically from the roster supporting the GBV side of the work. But it will be interesting to hear how that goes. Did you want to say anything else, Carmen?
No, but I think actually your point, thank you so much. I think your point is really interesting. And as you mentioned, indeed, we just started this first search capacity last year, just in time of COVID. And we were expecting 5 deployments and we did 20 last year. So we're learning a lot as we do. At the moment, the greatest request from country level is coordination and interagency work, but there's of course the option of training and evaluations and things like that, and we're really open to keep on looking with other sectors, how can we collaborate. And we've already done some good aligned work with the child protection AoR, for example, in Ethiopia. So I think it's always interesting to keep that channel open, and this is why I'm sharing the information specifically on Mozambique, but we could also just share in general, where are we having deployments? So that work can be supported. And I think it's also a good message for the donors, a little bit linking with what we've been discussed. The areas of work we are doing are so interconnected that there should be some common benefits to this type of deployment. So maybe it's a good point to continue bringing up in more conversations.
Yeah, it might be interesting to have, we sometimes have like 10-minute presentations on this call from different groups. So it might be interesting if you've already had 20 deployments from this this roster that's supported by the Dutch. It might be interesting to have a presentation on what learning you've had in this last year. We did have Koen talking to us yes, about his trip to Ethiopia on one of our calls where we focused on Ethiopia. So, and I know we've had core members also in touch with him, and one of our members has somebody now looking at MHPSS from UNFPA, and Trocare was there recently, and IMC is trying to go or going. I'm not sure, Micah, where you're calling from. So, but yeah, this is a big area of work for the AoR. So welcome to the call, and thank you for joining.
Thank you, and always grateful if you want to have a little presentation on the roster, also for exchanging this, how do you do these rosters and how do you engage donors and so on. I would be more than happy to join you in one of your calls. Thank you.
Okay, so Constance from HCR is saying Constance is aware of the funding situation and the need to capacitate national actors, including women-led organizations, and fully support advocacy and action on both. Yes, and you have making comments that saying that she can identify with some of the issues you're naming, which they've had to deal with also in Bangladesh, which is why peer-to-peer sharing and learning from each other is so critical. And Grace, who is from Action Aid, is saying that in spite of promoting leadership of national women's organizations in the GBV subcluster, would you consider that as a priority for the subcluster? And then said that they have organizations like Mulede who partner with Action Aid in Mozambique. So they have some partners that they could put in touch with you if you're not aware of those organizations. So that's an offer of resources, it sounds like.
Yes, that's great. I know Mulady is doing a great job, and they are one of the partners that are offering legal assistance for GBV survivors at that point. They seem to be doing a number of activities on GBV programming, but are also limited by funding. And yes, I would definitely look at promoting leadership of national women's organizations in the subcluster, which is, I can say, they reach where we cannot be able to reach. And so having them at the table is really important for the subcluster. And in the strategic advisory group, yes, we have slots for the national agencies as a must, so that we are in position to have a balanced table and have more information from national agencies and feedback as well. Thank you.
You answered my question before I asked it about the SAG, and if you have women-led organizations and national partners in the SAG. Would you say that they're participating in the decision-making that's going on within the subcluster?
I would say that not very much, but I see a movement towards that, because they are getting stronger, and they get to, more partners are actually trusting them to be able to implement activities on the ground. So yes, partners like Quam, FDC, and Mulady have a very strong leadership, and also are very interested in GBV programming, and as well decisions that are taken at subcluster level. Yeah.
And I feel like you're getting comments more than questions, but you mentioned, I think, that China is one of the potential donors.
Yes.
And I guess that's not one of our traditional donors on gender-based violence. So maybe you could say something more. What are they looking to fund?
They are looking to fund more on infrastructure as well, and also looking to fund more on commodities as well. So issues, for example, commodities on SRH, sexual reproductive health goods, and also the dignity kits, plus other prevention activities as well that are coming. They are coming to fund as well. So yes, they are not a very traditional donor, but we are beginning to see a lot of interest. And in the last I think the last 2 weeks, we've had substantive discussions with them on this. Yeah. Over to you.
And you also mentioned UNOPS. I'm curious because UNOPS is also not one of our traditional GBV UN partners.
Yes.
What are they supporting?
UNOPS has basically come up to, they just recently contacted the GBV subcluster with support. They intend to actually fund specific GBV programming on prevention, both prevention and response. And so in the last couple of months, they seem to have gotten funding from I think it was ECHO. I need to confirm that. And yes, they want to be able to increase more on GBV response in Cabo Delgado. So it's just at the initial stages, but yes, we are seeing them coming, and we're seeing them more interested in partners on the ground. Yeah.
That's interesting. You'll have to keep us up to date on that. You have Anita. I'm not sure, Anita, which organization you're from. anyway, she
Hi,
said it's
Anita, UNFPA, the GBV Sub-Cluster Coordinator for DRC.
DRC. Oh, of course. Anita, of course. I know you. Okay, sorry about that. So Anita said it's important engaging with women-led organizations because they are key to advocacy and community behavioral change. And Constance mentioned that it sounds like you already know a lot of the women-led organizations that she's familiar with, but that is giving out a reminder that Spotlight also has done a mapping of women-led organizations in Mozambique. So if you're not already in touch with Spotlight, that would be another possibility to take advantage of the mapping that they've already done. And then Emily Sue is saying Belt and Road Initiative, which I assume is related to China, maybe, but I don't know. Can you say something? Because that doesn't mean a lot to me, Belt and Road Initiative.
Yeah, no, I was just saying that this is likely part of their Belt and Road Initiative, which includes a huge commitment in terms of spending abroad outside of China, related mainly to infrastructure as well. So I know previously in some of my missions to both the Western Balkans as well as Central Asia, they've increasingly shown up at those high-level dialogues to participate in varying degrees on discussions relating to, for example, displacement, migration, etc. So they're really coming to sort of voice their or coming to I guess materialize on their foreign affairs policy increase a bit more. Blech. Sorry, can't talk today.
Yeah, I mean, we hear that China has been investing a lot in different parts of Africa, but I haven't heard them specifically supporting gender-based violence prevention response work. So I think it would be another interesting presentation to have sometime, actually, if we found the right person that could come and just talk a little bit about their work in this area or interest in this area as a donor. So I had asked Nina potentially if we had time to say just a little bit about the discussion that's going on right now around the definition of women-led organizations and women rights organizations, since this is an issue that I think many of us say women-led organizations and then others say, well, what does that mean? And I think for coordinators, it's been challenging, you know, when we talk about what percentage of funding is going to women-led organizations from SURF, for example, or, you know, we know the grand bargain, 25% of national organizations, but in the GBV world, we really talk a lot about women-led and women rights organizations. And if we're going to track funding and say, you know, how much funding, or if we're even talking about what's the participation by women-led organizations, then that definition becomes important. And I know in Call to Action, they talk about women's organizations, and in the strategy, we're kind of stuck when it's almost arriving at a definition, but not quite there. So Nina, are you still online? Do you want to say a little bit, since you sort of have been getting the actors together to try to resolve this issue?
Yeah,
There you are.
thanks.
Thank you.
Thanks, Jennifer.
And this is spontaneous from Nina. I asked her as a favor at the beginning, so
I'm really
thank you.
Really happy to talk about this. So I know we don't have a huge amount of time, so this is like really top line of purpose and process. So as Jennifer mentioned, a couple of us have come together, led by the Interagency Gender Reference Group, with representation from various other spaces, including the Friends of Gender, including actually Jennifer and Emily from the GBV AoR, and other stakeholders have come together to hopefully, inshallah, develop a definition on women's rights organizations / women-led organizations / girl-led initiatives, but to really come to a consensus on the framing, the definition. Obviously, this will be inputted into and reviewed by women's rights organizations rather than being imposed on any. So that is one kind of objective, the definition and the framing. The second is to start to track how much money is really going to those kinds of organizations. And thirdly, to improve and to advocate for the improvement of application processes to make funding more easily accessible to these kinds of organizations, and to reduce the reporting burden, recognizing that organizations don't always have, when they are small, the capacity equivalent, for example, to an INGO to do regular monthly reporting. So those are the three overarching objectives. And like I mentioned, we have many stakeholders around the table who are in different spaces already having this conversation, so that we can avoid duplication and really bring everyone around the table. If anyone has strong opinions about this work, or has something really valuable that they'd like to contribute, you can send me an email and you can join the small task team. And like I mentioned, this task team is a part of the Interagency Gender Reference Group. I'm going to pop my email into the chat box if you would like to participate. Thanks very much, Jennifer, for giving me the space.
Thank you, Nina. And you're getting lots of thank yous, Harriet, for your really wonderful presentation. I didn't mean to cut you off. I just wanted to grab our last couple of minutes since I had asked Nina if she could say something. So thank you for that update on Mozambique. And it sounds like lots of good connections being made there. And was mentioned by Nina, if you want to join this discussion on the definition for women-led organizations, then you can send her an email. She just put her email in the chat. And I know people are jumping off, but just to say on our next call, originally we wanted to have it be an MHPSS thematic call, but now we have the carryovers from IRC and Voices, so I'm not sure what the agenda is going to end up looking like. We have to see, but the idea is to have Paula Ramirez report on the mindfulness and wellness work that she's been doing with frontline responders on behalf of the GBV AoR. Also, IRC is going to present on their new MHPSS framework. So we have potentially someone from Ecuador talking about what they've been doing. So we'll put the call together, but there will be at least half the call related to MHPSS. I think also we're waiting to have an update from the colleagues who've been working on the central service package from the GBV AoR. So exciting next call coming up. And if you have ideas of what you would like to see in these calls, if we're trying to keep it balanced between presentations from the field and then also sort of global processes or new tools that have come out that can help facilitate more effective work in the field. So please do feel free to reach out to us and let us know if you're interested in presenting something or if you have ideas about something you'd like to learn more about. So thank you, everyone. We're 4 minutes over. That's pretty good for us. So thank you all for joining, and looking forward to hearing from you at the next call or between calls. And thank you, everyone, for your comments and being very actively engaged in this call.
Thanks, Jennifer. Thanks, everyone. Bye.
Bye, everyone.